Most men don't realize their penis ages just like their heart, brain, or bones ignore it. And you don't just lose function, you lose confidence, dignity, and connection. Hello, I'm Dr. Rena Malik. I'm a urologist and professor of medicine with over 10 years of experience in men's health, long specializing in helping older men preserve not just their sexual function, but their sense of identity. What if I told you that the number one cause of penile dysfunction in men over 60 has nothing to do with age, and that simple daily care, not medication, could change everything? In this video, I'm going to give you 5 essential ways to take care of your penis, backed by science and tailored specifically for men over 60. These aren't gimmicks. They are real practical strategies that can save your health and your quality of life. And make sure you stay with me to the end, because I'll reveal a final bonus tip that most doctors never mention, but could prevent one of the most painful penile conditions we see in older men. Let's begin with the first and perhaps most misunderstood part of caring for your penis as you age, keeping it active. Because the truth is, when you stop using it, your body starts losing it. One, stay sexually active even without intercourse. When I speak with men in their 60s and beyond, one of the most common misconceptions I hear is this: I guess my sex life is over. Now many have quietly accepted the idea that sexual function fades with age and there's nothing they can do about it. But let me tell you something important. Not only is that belief untrue, it can actually become the very reason function declines in the first place. Your penis, just like your muscles, heart, or brain, depends on use to stay healthy. When it's inactive for long periods, blood flow decreases, elasticity weakens, and tissues can begin to atrophy. That's not a scare tactic. It's basic physiology. The term we use is penile disuse atrophy, and it's far more common than most men realize. But the good news, it's also completely preventable. Sexual activity, including masturbation, isn't just about pleasure. It's about preservation. By keeping blood flowing regularly to the area, you're maintaining tissue health, oxygen supply, and function. Think of it like stretching a muscle to keep it from tightening over time. And if intercourse or solo stimulation isn't currently possible or comfortable, that's okay. There are other methods, like using a medically approved vacuum erection device, or even engaging in pelvic floor exercises that support circulation and performance. What matters most is that you don't go idle. Your body responds to use no matter your age, beyond the physical benefits. There's another layer here that's just as essential: dignity and identity. For many men, sexual vitality is tied to how they see themselves. When that starts to slip away, confidence often goes with it, but staying sexually active in whatever way works for you can help you reclaim not just performance, but pride. It's not about being who you were at 25. It's about staying connected to who you are now as a man with wisdom, experience, and value. I've seen men in their 70s regain control of their sexual health simply by taking this first step. And more often than not, once they do, other parts of their health begin to improve as well. It's a ripple effect. Confidence, in intimacy, motivation, they're all connected. Now that you know the importance of staying sexually active, let me show you something just as critical. It's something every man thinks he has under control until it's too late. Let's talk about hygiene, too. Keep it clean the right way. This might sound obvious, but after 3 decades of treating men in my practice, I can tell you proper penile hygiene is one of the most overlooked yet absolutely essential forms of self-care, especially as we get older. I've seen too many men walk into my office with infections, irritation, or even more serious conditions simply because no one ever taught them how to clean themselves properly. It's not about being dirty. It's about not knowing how age changes your body and how to adjust your care with it. As we age, our skin becomes more sensitive, immune response slows down, and the body isn't as quick to fight off bacteria or heal irritation. That means what may have been good enough hygiene in your 30s or 40s just isn't enough anymore if you're uncircumcised. This becomes even more important because bacteria, sweat, and dead skin can build up beneath the foreskin, leading to infections like balanitis or conditions that increase your risk for penile cancer. Yes, cancer, and it's not rare. Brazil, for example, Long has one of the highest rates of penile cancer, and the number one causes poor hygiene. That risk doesn't go away with age, it increases. But the fix is simple. Wash gently with warm water and a mild unscented soap. Nothing harsh. Pull back the foreskin if you have one, rinse thoroughly, and most importantly, dry well. Moisture can be a breeding ground for bacteria, especially in skin folds, and always clean after sexual activity. Vaginal fluids, lubricants, or even just natural sweat and oils can throw off the balance of healthy bacteria. On the skin, it only takes a minute, but that small daily habit could save you from painful infections, foul odors, or something far more serious. What surprises many men is the emotional shift that comes with this when you take care of your penis the same way you take care of your teeth, your heart, or your appearance. You start feeling differently about yourself, cleaner, more confident, more in control, and that's powerful, especially in a world that too often tells older men to step aside or give up on their bodies. But hygiene is just the beginning. There's something else you need to know, something most men don't talk about until it's already caused serious damage. And it all starts with what happens during intimacy when you're not fully ready. Let's talk about a hidden danger. Almost no one warns you about 3 avoid sexual activity with a semi-erect penis. This one might come as a surprise, but it's something I've seen far too often in my clinic. Men unknowingly injuring themselves during intimacy simply because they didn't realize the risks of having sex before they're fully erect. It may feel like a minor detail, especially when desire and the moment are leading the way. But attempting penetration with a semi-erect penis can cause damage that builds up over time, and the consequences can be life-changing. Let me be clear, your penis isn't just a tube of skin inside. It's a delicate structure of blood vessels, spongy tissue, and smooth muscle. When it's not fully rigid, it doesn't have the support it needs to withstand pressure. That's why forcing it to perform before it's ready can lead to what we call microtraumas, tiny internal injuries that may not cause pain right away, but gradually form scar tissue beneath the surface. Over time, this scarring can harden and pull on the surrounding tissue, leading to what's known as Peyronie's disease. If you've never heard of it, it's a condition that causes painful curvature of the penis, sometimes so severe that intercourse becomes difficult or even impossible. I've sat across from many older men who were too embarrassed to mention the changes they'd noticed until it was too late for conservative treatment. And the truth is, most of them had no idea this risk even existed. They weren't being reckless. They were just uninformed. That's why I want to say to you now, slow down. Your health, your comfort, and your confidence all depend on treating your body with patience and respect. Waiting until you're fully erect before intercourse isn't just safer, it's smarter. It protects you from long-term damage and ensures that sex remains enjoyable and pain-free. Use lubricants to reduce friction and take your time with foreplay or stimulation. Talk to your partner. If you're feeling pressure to rush, it's not worth the risk. And if you're using medications or aids to help with erections, let them do their job fully before proceeding. This simple act of caution could save you years of discomfort and frustration. And it's not about being fragile. It's about being informed and empowered. Now that you understand how to protect your body during intimacy, we need to shift our focus to something that affects not just the body, but the brain. And it's one of the biggest hidden threats to real connection and desire in older age. Let's talk about the unexpected cost of too much pornography. For limit porn, I maximize real connection. I want to speak honestly here, man to man. We live in a time when access to adult content is easier than ever. And for many older men, especially those who may be single, widowed, or feeling disconnected, it can feel like a harmless way to keep desire alive long. But after working with thousands of patients over the years, I can tell you this: what starts occasional relief can slowly become a replacement for something much deeper and more fulfilling, and it can rob you of the connection you deserve. The truth is, excessive use of pornography retires how the brain responds to arousal. It often trains the mind to rely on a very specific type of stimulation, fast, visual, and solitary. Over time, this can lead to what we call desensitization, where real life intimacy no longer triggers the same excitement I've had. Men in their 60s and 70s tell me they feel confused. They still have the desire, but when they're with a partner, their body doesn't respond the way it used to, and they think something is broken inside them. But in many cases, it's not physical. It's psychological conditioning caused by overexposure to porn. What's more, excessive porn use can create feelings of shame, isolation, and low self-worth, especially when it becomes a private routine that replaces human closeness. You start to question your manhood, your ability to connect and your value in a relationship that's a heavy weight to carry, especially when you're already navigating the emotional challenges that can come with aging. I'm not here to shame anyone. There's no judgment, but I do encourage moderation. Use it sparingly, if at all. Focus instead on rebuilding your natural arousal pathways through memory, imagination, or real emotional intimacy. That might mean taking more time with foreplay, talking openly with a partner, or simply allowing yourself to feel without pressure or expectation. Desire doesn't die with age. It just needs a different kind of attention. Limiting porn doesn't mean giving up pleasure. It means reclaiming it in a healthier, more meaningful way. It's about bringing your body and mind back into harmony so you can experience true connection, not just stimulation. And speaking of harmony, there's one final piece to this puzzle that ties everything together. It's the foundation that supports not just your sexual health, but your overall vitality. It's what powers your confidence, your performance, and your ability to enjoy life fully. Let's talk about lifestyle. 5, prioritize lifestyle over pills. If there's one truth I've learned after decades of treating men over 60, it's this: the way you live. Your life shows up in your sexual health more than any prescription ever could. Many of my patients come in hoping for a magic pill, a quick fix to bring back what they feel they've lost. But the reality is no medication can compete with the power of consistent, healthy habits. Your lifestyle is the fuel that drives everything from your blood flow to your hormone levels to your mental sharpness. And yes, your ability to perform and feel like yourself again. The connection between lifestyle and sexual health isn't just anecdotal. Its biological erections depend on good blood flow, and blood flow depends on the health of your heart and blood vessels. When you smoke, drink heavily, or eat poorly, you're damaging those vessels and limiting circulation to the most vital parts of your body, including your penis. Erectile dysfunction is often one of the first warning signs of heart disease, and it's your body's way of whispering that something deeper may be wrong. But here's the good news. Every healthy choice you make today has an immediate and lasting effect. When you stop smoking, your circulation improves within days. When you cut back on alcohol, your testosterone can begin to rebalance. When you start walking 30 minutes a day or eating foods that support vascular health like berries, leafy greens, and fatty fish, you're not just extending your life, you're enriching it. Your energy returns, your confidence builds, and slowly function begins to follow. What I love most is watching a man realize that his body isn't broken. It's responsive. It's waiting for him to show up again, to care for it the way it's cared for him. All these years, I've seen patients turn things around dramatically just by shifting their daily routine. They sleep better, they laugh more, they re-engage with their partners and with life itself, and they stop relying on pills because they've built something stronger, a foundation. So before you reach for another prescription, reach for your walking shoes. Choose water over whiskey. Prioritize rest. Connect with others. Your body is listening to how you live, not just what you take. Now, there's one final piece of advice I want to share. It's simple but surprisingly powerful, and most men have never even heard of it. It happens while you sleep, and it could be the missing key to protecting your manhood as you age. Let's talk about something unexpected: what you wear or don't wear to bed. Bonus tip: sleep without underwear. This might seem like a small detail, almost too simple to matter, but over the years, I've learned that it's often the quietest habits that have the most surprising impact. Sleeping without underwear is one of those habits, and once you understand why, it'll change the way you think about nighttime comfort and long-term health during sleep. Your body enters a natural state of repair and regulation for men. Part of that process includes spontaneous erections that occur throughout the night, something completely normal and actually essential for keeping the erectile tissue healthy and oxygenated. But when you wear tight or restrictive underwear, especially briefs or snug fitting sleepwear, you may be unknowingly compressing your penis during these nocturnal erections. Over time, that pressure can lead to tissue irritation, reduced blood flow, and in some cases, the development of internal scarring. That scarring, particularly when it goes unnoticed for years, can lead to a condition called Peyronie's disease, a painful curvature of the penis that's far more common in older men than most realize. Simply choosing to sleep nude or in loose-fitting boxers allows your body the freedom to restore itself naturally without unnecessary friction or compression. It may seem like a small adjustment, but I've seen it make a real difference for men trying to preserve comfort, function, and confidence. And if you're thinking, could something this simple really matter? Just wait until you hear how all these habits connect, because when you put them together, something powerful starts to happen. In the final message, I want to show you how these 5 essential steps and this bonus habit can help you reclaim something even greater than sexual health. Let's talk about dignity, confidence, and what it truly means to age on your own terms. Conclusion. I know that for many men, especially as we move into our 60s and beyond, talking about sexual health can feel uncomfortable, even unnecessary. But the truth is, your relationship with your body doesn't end with age. It evolves, and how you care for it now matters more than ever. What we've talked about today, keeping your penis active, maintaining proper hygiene, protecting yourself during intimacy, limiting overstimulation from porn, living a healthy lifestyle, and yes, even sleeping without underwear. These aren't just medical tips, that they're small acts of self-respect. Each one reinforces your dignity, your vitality, and your connection to who you are. I've had the privilege of helping countless men rediscover confidence in their bodies, not because they chased youth, but because they chose to care, to stay engaged, and to treat their sexual health as a meaningful part of their overall well-being. You're not alone if you've been struggling quietly or unsure where to start. The good news is it's never too late. Every day offers a chance to do one thing differently, to make one better choice, and to take one step toward reclaiming control. Your health doesn't define your worth, but it does reflect your attention. And when you take care of yourself in these simple, powerful ways, it shows in how you walk, how you relate to others, and how you feel inside. Thank you for being here, for listening, and for choosing to invest in yourself. You've taken the first step. Let's keep going together. If this message spoke to you or reminded you of someone who might need to hear it, please give this video a like and share it with a friend, brother or father. And don't forget to subscribe for more real conversations about men's health, because taking care of yourself should never come with shame, and you're never too old to start.